All right, well, we'll go ahead and get started today as people keep joining in. So welcome, thanks for joining us today. Just a few housekeeping items before we get started. Today's session will be an hour with time for a Q&A throughout the session. This webinar will also be recorded for future viewing, so we can share that. Please note that participation in this webinar qualifies for free CME credit, and that CME link will be provided at the end of the webinar. Also, any resources that we mentioned during today's call will be available after the presentation as well. So we also encourage questions, comments throughout. Please feel free to submit those using the chat function. If you'd like that shared anonymously in the chat, just send it to myself, and I will be able to share it at the end. So our panelist today has no financial relationships to disclose, and this webinar is approved for 1.0 AMA PRA Category 1 credit. So I am super pleased to introduce our presenter today. Dr. Joann Schaefer is a seasoned physician executive with nearly 30 years in healthcare. She served as Nebraska's chief medical officer, a family medicine associate professor, a CMO, an EVP at a major payer, and president of a private capital healthcare company. She's also led a venture capital board and sits on several community boards. As a grateful liver transplant recipient since 2008, she brings lived experience to every role. Known for building high-impact teams and transformation, Dr. Schaefer focuses on improving public health, growing businesses, and driving results. Passionate about physician and executive coaching as well as consulting, she's committed to helping leaders thrive and create lasting, patient-centered change in our healthcare ecosystem. So welcome, Dr. Schaefer, and I will turn it over to you to go ahead and share your slides.
Okay, great. Thank you. Let's see here. Hold on just a second. Sorry about that. Okay, are they sharing?
Yes.
Yay! Okay, now if I could just get it on my screen appropriately. Oh, I don't want to be looking right the whole time. Okay, why is this doing this? Well, I guess I'll be looking over here the whole time. This is crazy. I'm so sorry, guys. All right. Well, I want to talk about sleep. This is one of my favorite topics to talk about because sleep is so vital to our health, and it's something that we kind of cut out on a regular basis. And so many people complain about not getting the right amount of sleep or quality sleep, and it's just it's so important for us. So here's the basic physiology in a nutshell, and just a couple things that we'll talk about in terms of stages of sleep. And when this was discovered not too long ago about the functions of non-REM, NREM sleep, and REM, I thought this was one of the coolest things about our brain. So we're just going to talk about it for a second. So in REM, there's a very vital and function that takes place during this time. So it's when our brains are the little cells that hold our all of our important neurons together. It's called the glymphatic system. This is when they shrink up. All those tiny little cells, they kind of shrink up, and CSF flows in to our brain. And there's the portion of this is the importance of it is to flush our brain. So CSF flows in when all those little cells are shrunken up, and the whole point of this is to kind of flush away the junk of the day. Everything that we do throughout the day, every movement, every memory is made, every task is creating chemicals in our brain. And some of those are really important, and some of those are mundane, and they just need to go away. And so CSF rushes in when we are in NREM sleep, and it sits in there until we go into REM. And when we go into REM, all those little cells puff out and it flushes it out of our brain. and back into the CSF. So if you think about when we go through NREM and REM sleep throughout the night, those little cells are contracting, shrinking, and then puffing out, and our brain is going through this little flushing system. And that is how we get through all of the proteins, the tau protein, the toxins, anything that's in our brain and our system, our lymphatic system is taking care of that through the night as we go through our sleep phases. So there's a vital importance to us dreaming and not dreaming during that time. So it's super important for our brains for that. But there's also, this is why when you're going into REM, as you're flushing out those chemicals, that's thought to be why we have these wild dreams, because the chemicals of the day that are streaming through our neurons at that time is why you get these wild pickups from the day and these other things that have happened. That's probably why we have these intrusive dreams that pick up stuff from the days or days prior, or wild thoughts, because as those chemicals are rushing by our neurons, it's probably stimulating some of the dream factory that we have. So super cool function of our brain. Okay, now I have to figure out how to do this next slide. Okay, so here's a typical slide, a typical 8 hour sleep cycle of how we go into our stages of sleep. And all of the slides I'm going to show you are going to be a typical day worker, night sleeper. So we're just going to talk about that because most of us are that, although it would be reverse, obviously, if you were a night worker and a daytime sleeper. So we're awake and then we go into stage one sleep, and then we fall down into a deep sleep right away, typically in our typical sleep cycle. So we go right into deep sleep right away. We come back out, we go into REM, and then we go back into our deep sleep. So this is all these other stages are non-REM sleep. So we're popping up into REM, going back down into deep sleep, then we're popping in the REM. And so all of these stages are the non-REM sleep, and every one of these has just a vital role for this. And I have a reference down at the end of the slideshow, so you can read a book. It's a book. It's a wonderful book it's called Why We Sleep, and it talks about everything your brain is doing at night to reorganize files, tuck away the stuff that you really need to remember, and get rid of the stuff that is not important to remember. You know, the drives to work every day, the making coffee in the morning, all of these things that your brain considers not really important. You don't need to remember every step of every day. But those all created chemicals and memories, but your brain will start to reorganize that and dump it and get rid of it because you don't need to remember those things. But the vital stuff that you need to remember, the things that you're trying to learn, it is processing these files and putting them in deep memory storage so that you can recall them later. And that process all happens at night when you're sleeping in a very fine-tuned process that is fascinating to read about. So this is important for a couple reasons, and we'll talk about it as it pertains to sleep deprivation, napping, caffeine, and so I just want to talk about it a little bit, and then we'll get into a little bit more depth. So this is your normal sleep and circadian rhythm, and so this one straight curve here is your homeostatic sleep drive. Really important why we have that. And then this curvy one is your circadian rhythm. So we have this, I want to be awake and then I want to be asleep. I want to be awake and then I want to be asleep. You can see my mouse, correct? On the screen? Yeah, okay, great. So, and then this is just your normal sleep drive that tells you I'm going to be awake, I'm going to be awake, I'm going to be awake, and then I'm going to be awake, but I'm getting pressure to sleep, I'm getting pressure to sleep, I'm getting sleepy, 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 gotta sleep. It's relieved. And there's a reason why that's important, and we'll talk about in the next slide. So, this I want to be awake, but I'm starting to get pressure to sleep is a process that's created by um, adenosine. Adenosine is a chemical that's created by your metabolism throughout the day, and it's called sleep pressure. And so, sleep pressure is created by this chemical that you create. It's just a metabolite, and it is what starts to make you sleepy throughout the day. And then the maximum sleep pressure comes up here about, in most people, about 11 p.m. And your circadian rhythm is keeping you awake and awake and awake, and then it's telling you, hey, it's time to go to bed. So this process right here, when adenosine is at the highest and your circadian rhythm is at the lowest, this is called your sleep gate. And this is when you are maximum tired, it is time to go to bed, and most of us go to bed at this time. Trouble happens is when this process gets screwed up. Okay, this is when insomnia and all the problems start. The most common reason for why this process gets messed up is because the number one blocker of adenosine is caffeine. And so when we start taking in caffeine, we block adenosine, which no problem. A lot of us take in caffeine. I've got my little coffee cup right here with my partially caffeinated coffee. It gives me a nice boost. It's blocking all this adenosine, and then it stops blocking it at some point, and we get a little adenosine dump. The most common time for that to happen after we take caffeine in the morning is that we get an adenosine drop about 3 or 4 o'clock in the afternoon when all that adenosine comes rushing in. So 3 or 4 o'clock in the afternoon, we get the sleepies, very common. We're not very good. Our brain starts to get, oh gosh, I can't even think anymore. When that happens to you, you might want to start thinking about how much caffeine you're taking in the morning, because that dump of all that adenosine is just based purely on the caffeine that you're taking in the morning. And if you want to get rid of that afternoon dump, you cut back on the caffeine. So do half calf, or you can do what other people do, which is take in more caffeine at 3 or 4 o'clock. The problem with that is that you may not get another adenosine dump around your time that you're trying to fall asleep. Now, some people do, and they might take half calf during that time of the afternoon sleepies. Um, but it just is very physiologically dependent. We all have genes that control how we metabolize caffeine. So you have to be careful how much caffeine you're going to have in the afternoon. If you are a slow metabolizer and you have caffeine here, you're going to still be awake at this time, and then you can't get to sleep. If you are a rapid metabolizer of caffeine, you can have caffeine all day long, and you're not going to have much of a dump if if you stage it right. But at some point, it will catch up to you, and you'll get that dump. So the first thing I always tell folks that are having a hard time sleeping is you got to really pay attention to this curve right here, because however you metabolize caffeine, this one is going to be affected the most. The other thing that kind of messes up this process is the famous, you know, early evening nap. Because if you take a nap, you metabolize that adenosine and then you lose your sleep pressure. So we'll talk about that in the sleep diaries later. But a 15 to 20-minute nap is not going to relieve all your adenosine. But if you take an hour and a half nap in the early evening, you're going to lose all that sleep pressure that you need to go to bed. So that's the second thing I tell people. Don't take long naps. Little tiny snooze is fine. Can refresh your mind. But if you take too long of a nap, your adenosine goes away and you lose the sleep pressure. So hopefully that makes really good sense, and and you can adjust accordingly. Now, what happens when you have sleep deprivation? So this is what explains the next day, kind of high, and why you can get through the next day. Um, so here, you had all that adenosine and you didn't get any sleep, or you hardly got any sleep. You didn't relieve that adenosine. So you still have the next day's worth of adenosine coming through. So this is where, people keep taking caffeine the next day and they can survive. But what happens is that your circadian rhythm is now kicking in. And so you can get through that next day with the double added, adenosine is you get a lot of pull from your circadian rhythm that helps you stay awake that second day when you have sleep deprivation. So that's why you can pull through. But okay, now I don't even know how that happened. Oh my goodness. This is the strangest thing. I've never had this happen on the PowerPoint before. I'm so sorry. So that's why you can get through. But when you have so much adenosine in your system and you've got this wake cycle that is keeping you up, this little, buildup of adenosine is why you can get so many mistakes and brain fog and all that stuff that's happening to you. Your brain is just not designed to be able to do that. So we all have done that, on-call residency, medical student time, and then even still as faculty and out in practice, we pull through those days. But just recognize this chemical is not your friend trying to stay up. And that's why you get the brain fogginess. You're prone to mistakes, word searching, all the nasty little things that we do when we're sleep deprived. Blame it here. But it is also why caffeine is so effective because it blocks that chemical. It can make us, get through the time that we need. And we get a little bump from our circadian rhythm that's keeping us up during that time. Okay. So, why, how do we get, sleep hygiene and what are some tips for this? So, um, theoretically, you should sleep as much as you need to feel refreshed the following day. Everybody has a different time that they need to sleep. People like to say 7 to 9 hours is what the human brain and your body needs to be refreshed, but everyone's different. There is a gene out there that allows some people to be healthy and get by with 4 hours of sleep. It's rare. Not too many people have it in the population, but there are people that have that gene that allows them to get the complete refresh, reset their brain, do everything that they need to do, and act and be completely normal with 4 hours of sleep. That is the gene that allows you to do that. It is rare, but it does exist. Most people, however, need a full 7 to 9 hours. Um, I know I am a 7.5 to 8 hour girl, and when I do a lot of stuff, I need a little bit more. The key to proper sleep hygiene that people kind of miss is that it's really important to get up the same time each day, 7 days a week. There really isn't a catch up on the weekend. Um, you can do it, but it's not, you're better off getting up at the same time of the day and then taking short naps on the weekend if you need to catch up or feel a little bit more refreshed. After I've shown you that process with the circadian rhythm, the process S and process C, I hope that helps you understand why physiologically your body just really wants to get up at the same time every day and go to bed the same time. I know that there are times where that's just not possible, but just recognize that physiologically your body craves that routine and will behave better for you when you give it to it. Um, Exercising regularly early in the day, the studies show that's better, and there are physiological reasons for that. Your body doesn't like to be hot when it goes to sleep, but some people pull this off. So some people can exercise in the evening, cool down appropriately, and be ready for bed, and it's a great relaxer for them. So again, everyone's different, but the studies support early in the day. Your bedroom should be comfortable and free from light, noise, and it should be dark and gadget free. The bedroom is a comfortable temperature at night. Your brain really likes 68 degrees, according to studies. This is very well supported. Um, why 68? Well, because your brain is going through so many processes. You got to think of it as a supercomputer, and all supercomputers like really cool rooms. If you go more than that, if you go higher than that, your brain just doesn't function as well when it's going through all of these processes. You get hot and your sleep is interrupted. The first thing I tell folks, and this is true for kids and babies as well, 68 degrees is kind of a magical number for your body to get proper rest. Get the amount of sunlight, especially in the morning, or get adequate sunlight. So, yeah, sleep with those window shades cracked, so when the sun rises, you're getting bright sun in there. And as soon as you get up, get that light exposure to your eyes. Cut down on all caffeine products. You got the gist of why that's important. If you're having trouble sleep, really check going to sleep, check out your caffeine and your sleep drive. Alcohol, especially in the evening and before bed, it's important to know that, alcohol can make you sleepy, but the metabolites of alcohol, especially wine, are very caffeine-like. So this explains the, gee, I had a couple glasses of wine in the evening and I fell right to sleep, but then I was up at 2 a.m. It's because when it's metabolized, those metabolites really get your brain going. And so you wake up. Obviously, smoking can disturb sleep, vaping, same thing. Um, and then this habit of taking your problems to bed has got to stop. It's easier said than done, but if you train your brain to not think about work or any of your problems when you go to bed and train your brain to shut it off, that's an important thing. And then this thing about, excuse me, trying not to fall asleep. In other words, you go to bed and you gently fall asleep, but you don't sit there and try to fall asleep. The harder you try, the more you will keep yourself awake. And then the key of not lying in bed awake, um, and then don't go to bed early, just to escape things. So don't go to bed because you're having a bad day and you just want to escape something. You go to bed to go to sleep. And if you're lying awake in bed, you got to get out of bed. And we'll talk about that a little bit. So, eat regular meals and do not go to bed hungry and avoid a large meal before bed. So, a good thing, if you're going to have a little snack before bed, is a simple carb. It will digest easy and it will not make you hungry. And it will help or will not give you a problem to be hungry before bed. Avoid excess liquids in the evening because obviously you're going to get up to go to the bathroom. Avoid medications that can disrupt your sleep. And I had a couple of questions about medications. So here's the thing with medications. I had questions specifically about statins and beta blockers. So if a medication is very lipophilic, then it can cross the blood-brain barrier easily. And if it's hydrophilic, it can't. So there are some statins that have been associated with sleep issues because they're very lipophilic, and those are simvastatin, lovastatin, and atorvastatin. But pravastatin is hydrophilic, so it doesn't cross the blood-brain barrier, and so people have less sleep disturbances on pravastatin. So that's one. And then with beta blockers, the same is true of metoprolol. It is more lipophilic, so it crosses. And the less lipophilic are atenolol and Vistolic. So so you can adjust medications based on that, and you can easily find out. Honestly, it's easier to find out if you Google it than it is if you go down and read the manufacturer extremely long you know, drug information. Um, and then when you Google it, it will link to the studies and it'll link to the proper documentation that you need to really find out if it's true. Um, but some studies will say that this is a placebo effect that patients are feeling. Other studies say that it's true, and when they've done it in blinded studies, it is true that people have more vivid dreams on the drugs that are lipophilic. So, I think when you review medications for patients, if they're complaining about vivid dreams or difficulty sleeping, you might want to do a review list with that because it can happen with some drugs. Um, this is a really important one for your brain, using a wind down routine before bed in a relaxation process. So When you get into a process before bed, it does send a message to your brain. It's time. It's time to start, getting things in order to sleep. And it can be as simple as I'm going to wash my face, brush my teeth, do whatever face routine that I have, and put on my pajamas, and I'm going to make my room dark. And then you can go do the routine of whatever else you need to do to, get ready for work in the morning, pick out your outfit or do something like that. But then your brain is starting to think, oh, it's time to go to sleep. And the more often you stick with that same routine, your brain will start to send messages of getting sleepy. And so if you continue to do that same process at night and then go to sleep, and I don't mean go to bed and turn on the TV, I mean go to bed or get on your phone. I mean, go to bed, turn off the light, and go in to go to sleep. Your brain will start getting the message. And the earlier you do that, the more settled in you become because your brain is not dumb. It knows that it's time. But you got to stick to the routine, go to bed about the same time each night and get up the same time each morning. One thing that you can do is take a hot bath before bed or a hot shower. Now, this seems counterintuitive because it's like, well, you don't want to be warm before you go to bed. But what happens is you do those warm things, and your body then gets rid of some heat. And so you're not really warm before you go to bed. You actually cool down a little bit before you go to bed, and your brain really likes that. Turn the clock around so you can't see it. And then again, avoid naps after 3 p.m. So here are some screening tests that are free online and easy to use. When Lindsay puts up the PowerPoint, she's going to put links to these studies so that you can play around with them, use them, see if there's anything that you like to use for either yourself or your patients or your loved ones. Here are some treatments and strategies beyond sleep hygiene that we just talked about. Um, Here's a sleep diary and some key elements to put in a sleep diary. This is something you can do with your patients or you can do it with yourself. You just want to keep a little diary about how you slept and what were your routines the night before. So you mark in there your sleep and awake times every day. You can do it for a couple weeks. The number of awakenings you had the night before, triggers associated with those awakenings. Was it bathroom? Was it nightmares? Was it hot flashes? Was it, this, that, or the other? Just put them down. Stressful events during that day that may have been the reason why you couldn't sleep or why you were waking up. The timing and duration of exercise. Try to figure out, was it exercise that late in the day that was associated with you awakening? You're just trying to figure out what are some of the triggers that were associated with you not sleeping well. Note your alcohol and caffeine consumption and what time it was to see if there's an association there. And then put down your bedtime routines. Um, Note any medications taken before going to sleep, and then record this all upon awakening. So you can do a thorough sleep diary of trying to figure out what your triggers are about why you're not sleeping, because it's really important to try to understand you, because everybody is different. And before you jump to some drastic change in your routine or medications, etc., you kind of want to figure out really truly what's going on. So here's some therapies and some trainings that we'll talk about just briefly. So stimulus control therapy, sleep restriction therapy, and then second line therapy interventions. So stimulus control, this is associated with bed and sleepiness. So regular morning rise times, we talked about that. It strengthens your circadian clock. You go to bed only when sleepy. After 15 to 20 minutes, if you're not asleep yet, you got to get out of bed and you do something relaxing. It's not watching TV, but you got to do something like reading, something simple, um, you know, picking up items in the house or cleaning the kitchen, but you just do something that's kind of relaxing and mundane that doesn't require your brain to get super activated. And then when you get sleepy, you go back to bed. If you're not asleep within 15 to 20 minutes, you get right back up out of bed and you keep doing something that's relaxing. You get sleepy, then you go back to bed and you keep repeating this cycle until you go to sleep. It sounds it sounds like not much fun, but it will associate your bed with sleeping and it will get you to um, you know, focus on the bed is for sleep. And I'm going to continue to repeat that cycle until I adequately fall asleep. But then you got to get up in the morning and no naps or minimal naps, 15 to 30 minutes. And and you got to get up at the same time every single day. You might not get much sleep the first night or two, but if you repeat this, you are likely to get back into a nice sleep cycle. But it's important that first night or two, you get out of bed if you're not asleep after 15 to 20 minutes. Sleep restriction therapy is similar, but it's a little bit more drastic. And this can be done at facilities, and these are people that are really struggling with insomnia. Again, it is meant to make sure that they get that sleep drive corrected. So they're working on that circadian rhythm, but they're also trying to get that adenosine sleep drive back. And they are, you are restricted from sleep and you only go to bed when they are able to fall asleep, and there are severe restrictions on your time in bed in order to get that sleep drive, usually done in a facility. Again, it's much more restricted sleep time, but can be very successful for folks. Second line interventions are things like phototherapy, full spectrum wavelength light exposure to your eyes during the day, particularly so that you can get that strong wavelength and strong exposure during the day. Especially for people who work inside all day, this is not necessarily difficult to do. Get full spectrum wavelength lights sitting on their desks, so you're getting some really good sunlight exposure during the day, especially like I said, if you're inside. These are simple enough to do. Progressive muscle relaxation. It can be guided and practiced. And there are a lot of apps out there that can teach you, that can give you these things now. And I'll talk about a little bit of this in a minute. Um, Autogenic responses. This is exercise to produce physical responses. This is a guided thing to create warmth and relaxation. Breathing by count. So things like box breathing, again, guided. Imagery, focused exercise on time and place. This is a fun one. I do this a lot to fall asleep. And this is simple. You can do it at any time. The one that I do is when I'm falling asleep, I pick a place that I want to travel to, and I go into exquisite detail about packing a suitcase, getting on the plane, flying to the destination, getting off the plane, driving to the destination, my first views of the destination, wherever it may be. I'll pick a country and I just fill in all the details. If I break that and start thinking about tomorrow's problems or whatever, I go all the way back, pack the suitcase, get into the suitcase, go to the airline, get on the plane, fly to the destination, and I just keep starting over anytime I break that cycle. But the imagery of what I want to do is that destination. And I just keep reinforcing what I want to do that night. And it is so helpful to have that imagery in my head. And would you believe I drag it into dreams often? And so the same place that I'm visualizing, I'll just pop it into a dream. So these tools, these little tricks can be extremely helpful. Usually when I'm doing those, I'm asleep within about 5 minutes. So if you get really good at training your brain into a process, progressive muscle relaxation is really, really helpful for people. And like I said, I'm going to talk about that in a second. But these are easy tricks for you to use in teaching yourself to fall asleep. So trackers, there are a bunch of them. I've tried a bunch of them, and they're just helpful and they're kind of fun to use. Aura Ring, Whoop, the Google Watch, Ready Band, and then there are medications, and we'll talk about those too. These are examples of the sleep trackers, and why I wanted to talk about them is I'm not a promo or a salesperson for any of them, but they're really cool with some of the things that they can do. The Aura Ring, it tracks your sleep and it can track where you're in REM and not in REM. It's just fascinating and it will give you a sleep score. But what I like most about all of these, the Whoop and all this, they come with an app, and within the app, they give you all those progressive muscle relaxation, imagery, guided breathing, all sorts of things that you can do to help you fall asleep. They just have tons of things that come with the programs in them. So if you're tired of watching the ones on YouTube because you have to get up and then shut off your phone or do or you listen to commercials before they start, these come embedded, they shut off on their own. They are kind of nice, and all of them have them. So I'm not promoting one or the over the other. They're just really nice. They've really thought these through, and they have all sorts of things that you can use to help you fall asleep, and they're really well done. So kudos to them for focusing on sleep. I think they did a great job on some of the on the trackers. And like I said, they come on your phone, and there's just hundreds to listen to. So kudos to them. I think they did a great job. So sleep is a big problem and a big business. This is one of my favorite slides. It took 40 years for Star Wars to earn 4 billion in revenue. 40 years. But it took Ambien, Zolpidem, 24 months to earn the same amount of money. So it tells you what a big problem sleep is for our country. It's a big darn deal. And there are a lot of people really struggling to get quality sleep. But based on everything I told you just now, I would hope that you would think of a lot of it is our own doing. Most of it is tied to our own doing. Now, of course, there are some jobs, there are some medications, there are some things that can't be avoided. But there are some times where you really need to look at medications. But I want to just clear up some things about sleep medications that are important for you to know. So you have non-benzo sedative hypnotics, um, and these bind to GABA-like receptors, which increase sleepiness. Benzodiazepines enhance the action of GABA, which slows the activity, making sleepiness happen. Orexin receptor antagonist, orexin keeps you awake, so if you block it, it increases sleepiness. Melatonin receptor agonist. Melatonin regulates the circadian rhythm and induces a sleepier feeling. So, general points about medication. This is the number one thing. Medication causes sedation. It is not sleep. There is no medication on the market that creates sleep. It just creates sedation. So all that important stuff that I talked about that your brain is trying to do when sleep happens, medication is not mimicking that. It is just making your brain sleepy. It is making your brain become sedated, but it kind of wipes out those processes that are really important for your brain to function and to give you a start at the next day. So that's why there's so much grogginess, there's amnesia, there's all this stuff. So while it's helpful to use in certain instances, medication doesn't, there just isn't a sleep creator. It just creates sedation. So it's just important for you to realize that, they're working on it. They're trying to come up with a pill that actually creates sleep, but there just isn't one yet. And so I always want to make that point because we live in a world that really wants to have sleep, but there really isn't a medicine that causes sleep. It just causes sedation, and it robs you of the important functions of your brain at night. So melatonin, big misunderstanding about that. It's okay to try, but it's often dosed way too high, and there's wide variability because it's not regulated at all. So even in a single bottle, you can have wide variability from pill to pill. So most of the time it's flooding your receptors and it's not doing any good at all. The best doses are between zero point 0.5 and 2 milligram, but it's still likely overdosed in most cases. And studies tend to believe that it's largely placebo effect that people are getting when they take melatonin. Lower is probably better than these bigger doses. Um, all sedative hypnotics have the potential to be associated with impaired memory, grogginess, sedation, and amnesia. And then this is the big one. There are over 15 serious, large case match correlation studies that have increased risk of death from infection, motor vehicle accidents, and linked to cancer. So um, there's more studies that are needed and proper informed consent. So these meds are not to be taken lightly, and they're not great. They are what we have, and I'm not advocating for not using them appropriately. Um, I think I use Ambien when I travel to Asia to help flip my clock. One of the things that I've noted is that there's a strong rebound effect from it. So you can't just take a pill and then think you're going to be okay the next night. You will have mad insomnia the next night, I've noticed. And so you have to take it and then wean yourself off, take a smaller dose the next day, which I just find to be fascinating how quickly your brain becomes not addicted, but it will pay you back for taking the medication if you need it for a few days. Um, Scientific data on all sleep aids show minimal benefit over time, with just some exceptions. So, um, uh, intermittent use is the best, and as you can see, most sleep medications come with a warning of no longer than 2 weeks. Um, but uh, and so they can be useful, but just to be cautious with them. CBTI is the most effective sleep treatment and has been shown to be effective even 10 years after its use. So cognitive behavioral therapy for insomnia. This is just the basics on it, but you got to find out the 5 processes that maintain insomnia. So worry, selective attention to the monitoring for some sleep-related threats, misperception of sleep and daytime deficits, um, unhelpful beliefs about sleep, and then counterproductive safety measures. So these are the things that the counselor is going to be going through when they work with somebody for severe insomnia. So what are these things that are causing the person not to sleep, basically? And then 3 phases for treatment using this. So it's a complicated and thorough process of training somebody how not to be focused on their insomnia, and it is not an overnight process, but this process is solid. And again, studies have shown that once somebody goes through a significant cognitive behavioral therapy for this, it has lasted 10 years. So for someone who really has problems with sleep, um, uh, this is the way to go. And it's a time investment. Um, but this is what really will help sleep in somebody that's truly suffering from insomnia. So here's the book, Why We Sleep, that by Matthew Walker. Um, it is an incredible book. I learned so much about sleep. One thing that I learned that I always like to share is when you travel, you probably notice the first night you're there, you don't sleep very well and you wake up a lot. Um, Completely normal. And it's something that we've inherited. It's a very primitive instinct, and whales have this ability to sleep with one half of their brain awake. So when they're in their pods and they're sleeping, they may be very still, but half of their brain is awake. And we have the same ability. We have this primitive instinct that we are in a new place. Half, not half, but a very small portion of our brain will be on the lookout when we're in a new place. And it's taking note of all the sounds around us in this new place. And we don't get into our deep levels of sleep. We don't go down into that in REM deep level of sleep the first time we sleep somewhere. And then as soon as our brain takes note of all the sounds, say we're traveling and we're staying in the city, it will notice all the traffic, it'll notice the sirens, it'll notice all the creaks and all the popping or any sound that is in our hotel room. And then the second night, it'll allow you to have a good night's sleep because the brain has recorded everything that's around. And it's a primitive instinct that we have maintained. And it's whales have the same issue. So I thought that was the coolest little brain fun fact that we have with sleep. And so if you're ever traveling and the first night you're there and you don't have a very good night's sleep and you don't feel rested, that is why. There are way more fun facts in that book than just that. And then the sleepfoundation.org has a lot of other information for you and for your patients. And then the NIH also had an incredible amount of information on sleep. So there you have it. And if there are any additional questions, I will stop talking and stop sharing my slides.
Thanks, Dr. Schaefer. You really addressed a lot of the questions that came in, especially before the presentation about things that people were interested in, particularly, waking up in the middle of the night, like concerns about patients or workload. And I think you talked a lot about that within the sleep diary components. One question that we did have that came in that if you could maybe just touch on is how can a perimenopausal or postmenopausal woman maybe manage sleep and hormones?
Yeah, that's great. So much of sleep issues around menopause and perimenopause has to do with hot flashes. Not all, but do make sure that you are sleeping in a cool room, that they have these pillows called chillos that allow your head to be on a cooling pillow. And as a reflection of how much your brain really does like to be cool, um, light sheets, multiple colors, covers, because you will, like turn into a starfish, like everything get away from me. And then you get cold and then you want everything out. And then you can do the leg in or out or in or out. All that is really normal as your body goes through this incredible vascular change. Um, I the proper temperature is probably the most important thing. Sleeping with the fan on, all those are really important to keep your body cool. And then obviously you're going to get too cool at some point and you're going to want to bundle. So uh, that's all normal. And do what feels good, but I would just maintain a cool room because you're vasodilating so often and you're getting rid of the heat, and that is totally normal. Um, Really do watch, for you because of the vascular changes that you're having at night, which are most commonly associated with dreaming. Um, things like caffeine and alcohol are going to affect you a lot more during that time. Um, there are medications that can help. They're not sleep medications, but obviously medications for hot flashes are really helpful during that time. So talk to your doctor about that. Outside of that, there isn't a lot, but sleep routines um, are 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 really vital during that time as well. If you're laying in bed awake, again, get out of bed, do something relaxing, go back to bed, do those practices because they will help stabilize your sleep cycle. And then talk to your doctor about medications for hot flashes. It does get better. It does get better. And, the role for HRT during that time too, whether or not you're a good candidate and whether it's right for your body, those are all things to be considered.
Great. Any other questions on the call? Well, I did want to share just one last thing. So just as a reminder, you do have a resource available, LifeBridge Nebraska being one of them. Individuals have issues with sleep that pertain to things with their job. And so our LifeBridge program offers free and confidential peer-to-peer physician coaching to all Nebraska licensed physicians. So you can call that confidential line and be paired with one of our coaches and talk through, if it's something with sleep or any other issue pertaining personal or professional life. And I wanted to note that following the passage of legislation in 2023, LifeBridge is the only program in the state that is protected under statute. So physicians participating in this program are protected against discovery, are not obligated to disclose involvement to any healthcare facility, hospital, medical staff. And so we're really proud of that for our program, a very safe, confidential place to have those conversations. And then finally, this program remains at no cost thanks to the generosity of our sustainability partners. So we are very fortunate to have those and appreciate that. But I will open it up. If anybody had any last final questions, that CME link is provided in the chat, but that will also be shared with the recorded webinar on our website. So there's no other questions. We appreciate you guys joining us today. Dr. Schaefer, thank you so much. This is always a super interesting topic, so appreciate your time.
Yeah, thank you, everyone. Have a wonderful day and happy sleeping.
Yeah.